Chief Minister Dr. Manik Saha inaugurated the 34th Annual Conference of the Northeast Regional Chapter of the Indian Association of Pathologists and Microbiologists at the Karl Landsteiner Auditorium of the AGMC on Saturday. During the event, the Chief Minister underscored the radical improvement in healthcare services and infrastructure across the state in recent years. The 3-day conference, inaugurated by the Chief Minister, is hosting delegates from various parts of the country, focusing on the latest advancements and challenges in pathology and microbiology in the Northeast region. Dr. Saha provided key statistics. The combined bed capacity of the state's 2 primary medical facilities, GB Hospital and AGMC, has been significantly increased from 727 to 1,413. The state has successfully completed 4 kidney transplantations. Preparations are actively underway to introduce both liver and heart transplantation facilities in Tripura. Dr. Saha confirmed that the Tripura government has recently signed a memorandum of understanding with aims in New Delhi to foster collaboration and capacity building in the health sector.
Northeastern Region Chapter of the Indian Association of Pathologists and Microbiologists. I extend my warm greetings to all the delegates who have come from different parts of the country to participate in this important gathering. Pathologists and microbiologists form the backbone of our healthcare system. They work quietly behind the scenes, ensuring that every diagnosis is accurate and every treatment is based on solid scientific evidence. Their work strengthens the very foundation of modern medicine. The Northeastern Regional Chapter of IUPM, that is Indian Association of Pathologists and Microbiologists, has been carrying forward this noble mission for more than 4 decades. I am proud and delighted that this year's conference is being held once again in Agartala for the 3rd time after 2027 and 2016. This shows Tripura's growing importance in the field of medical science and healthcare. Friends, in the last few years, Tripura has made remarkable progress in improving medical infrastructure and services. Some of major initiatives are: the number of beds in Agartala Government Medical College and GBP Hospital has been increased from about 727 to 1,413. The state has successfully conducted 4 kidney transplants, and we are now preparing to start liver and heart transplant programs. To make healthcare more humane, we have started the 10 rupee lunch program for patient attendance and we are going to set up Bharat Mata canteens and night shelters for people coming from the distant corners of Tripura for cheaper stay and food. The AIMS Tripura MOU signed recently in New Delhi when I went there will further strengthen medical education and service delivery in our state. We are proud that the Agartala Government Dental College has opened with the advanced facilities like a laser treatment unit and 3D printing lab. The number of BDS seats has also increased from 50 to 63. Our government is committed to making healthcare accessible to all the people, or the suffering people of Tripura. Under the Pradhan Mantri Jan Arogya Yojana, more than 16 lakh beneficiaries in Tripura have received Ayushman cards. Claim worth rupees 250 crores have been settled. That is 100% saturation we have achieved. Similarly, under the Chief Minister Jan Arogya Yojana, more than 2.5 lakh families have been covered, and medical claims of about 26 crore have been processed. 1,128 Ayushman Bharat health and wellness centers are operational across the state, bringing healthcare closer to every doorstep. The state had also taken bold steps.
The inaugural session was attended by several key health officials alongside the Chief Minister, including Health Secretary Kiran Geet, Health Director Dr. Tapan Majumdar, the Director of Medical Education, and the Director of Family Welfare and Preventive Medicine. Reported by Pranav from Agartala, Chini, Khorang.